So we're going to begin the membrane potential here, and this is really carrying on the discussion that we began when we started looking at the forces acting on particles to move them across the membrane. And so we talked about factors that affected the particles themselves. We talked about the factors related to the membrane. And so we're going to put that together and think about how do we establish the resting membrane potential? We've talked about what that value is. It's about -70, and it means that the inside of the cell is more negatively charged than the outside of the cell. But how did we get there? How do we establish that resting membrane potential? So that's what we're going to discuss here. Okay. Our first lecture objective is to explain the ionic basis of the resting membrane potential. Okay. And so when you think about the resting membrane potential, it's the standard sort of environment that exists across the cell membrane, especially in excitable cells like muscle cells and neurons. And it's the baseline for which we can then excite those cells. So the resting membrane potential is really determined by the equilibrium potentials of the most prevalent ions that are moving across the membrane, and those happen to be potassium and sodium. So that doesn't mean that calcium isn't moving, chloride isn't moving. They are, but the most prevalent or most influential ions on the resting membrane potential are sodium and potassium. And so thinking about the equilibrium potentials for these two ions is really important in understanding how the resting membrane potential comes about. Now, we described what it is, right? It exists because there's more negative charge inside the cell and more positive charge outside the cell, at least at rest, right? Again, so that's just a baseline for excitability. And when we think about different types of cells, they can have varying resting membrane potential. So it can be as low as -5 millivolts and as high as -100 millivolts. When we get to the cardiac chapter, we're going to talk about the cardiac muscle cells, and they have a resting membrane potential of -90. So different cells will have different resting membrane potentials. Most of our neurons, which is going to be the focal point of our discussion, have a resting membrane potential of -70 millivolts. Okay, and so from that -70, we can then manipulate the movement of ions to change that membrane potential to excite the cell. For example, when a neuron is excited, that is firing an action potential, its membrane potential goes all the way up to +30. So the -70 is just the baseline sort of resting membrane potential value upon which we can excite those excitable cells. Now, why is the equilibrium potential important? And why do we want to think about the movement of these two ions, sodium and potassium? So it's important to think about the concentration gradients because we know that those are important in the chemical force, right? So in talking about movement of these ions, we need to think about their gradients first. Where do we have more sodium? Where do we have more potassium? And where is the concentration gradient, the passive movement of these two ions? The other thing we want to think about is the membrane permeability. And to think about the membrane permeability, we want to think about the ion channels because we know that charged particles like sodium and potassium, they cannot go right through the phospholipid bilayer, so they are going to need ion channels. Another way to say this is that the membrane permeability for sodium and potassium is a direct reflection of the number of ion channels on the membrane and the state of those ion channels, whether they're opened or closed, and that will tell us what the permeability looks like, okay? Now, here are some helpful terms. We're going to talk about the potential difference, the membrane potential. We've already introduced this and we've described it and defined it. We're going to talk about the resting membrane potential, which is the membrane potential in a resting cell. And then we're going to talk about other types of potentials as well. Graded potentials, which are smaller, less important changes to the membrane potential. We're also going to talk about synaptic potentials. Um, and then the most important one being the action potential. The action potential is a large, rapid, meaningful change in the membrane potential that is going to excite the cell's plasma membrane and can communicate electrical signals from one cell to the other, right? From neuron to neuron, from neuron to muscle, from neuron to glands, etc. So these are terms just to orient yourself, but it's also a nice place to come back and reference as we use these terms, just to make sure you have a correct understanding of what they mean. But I would underline the action potential, the graded potential, the resting membrane potential. Those are the three most important ones that are going to be, that we're going to discuss. Okay. Let's talk about the sodium potassium pump. We've also begun describing the sodium potassium pump. You should recall at this point that it is an example of primary active transport. And so it's going to pump 3 sodiums out of the cell against their gradient and 2 potassiums into the cell against its natural gradient. So the sodium potassiums are going to be important because they are helpful in establishing the resting memory potential. 20% of the resting memory potential is going to be directly owed to the presence of the sodium potassium pump. Why is that? We know the resting memory potential is a negative charge inside, positive charge outside. So if you have a pump on the cell membrane that is pumping positive charge out, right? 3 positive charges out and 2 positive charges in, you automatically have a net loss of 1 positive charge just because of the sodium potassium pump. So the sodium potassium pump is going to create 20% of the resting membrane potential. A good question here. So question is, are both sodium and potassium going against their gradient? So this is interesting because we're going to look at the ions and how they're moving independently. So we haven't necessarily, described whether sodium is moving in or out of the cell, but both types of movements are going to be happening to establish the resting membrane potential. But we're going to break it down and look at how each of these ions are moving according to different forces. Because remember, both forces are acting on the ions. A chemical force is acting to move it in one direction. An electrical force, because it is a charged particle, is also moving to move it in another direction. So we're going to break down the individual forces and then we're going to put it together. Okay, so we haven't quite gotten there yet. Okay, we're still talking about how the sodium potassium pump is, helpful in establishing the membrane. So 20% directly owed to the sodium potassium pump because we're having a net loss of 1 charge. 80% of the resting membrane potential is indirectly owed, okay? Because we're creating concentration gradients. We are pumping sodium out, so now sodium is at a higher concentration outside the cell, right? Because we're pumping more of that out, a lower concentration inside the cell. So indirectly, the sodium potassium pump is also contributing to a more negative environment inside the cell, okay? Because we're creating a gradient. Same thing for potassium. We're pumping potassium in. So now potassium is at a higher concentration inside the cell, lower concentration outside the cell as well. So when we think about a typical neuron, we want to understand here that it has a greater permeability for potassium. That's another important piece of the puzzle to describe before we start talking about how each ion is moving. So there's more permeability for potassium. And when we say the word permeability, you should be thinking in your mind channel because these ions cannot go through the membrane. So really important to kind of have that association. Whenever I describe a permeability of an ion, I'm really just saying that we're manipulating the channels for these ions. So because we have a permeability that is 25 times more for potassium than sodium, another way to say that is we have 25 more doors for potassium to move through the membrane than sodium can move through the membrane, all right? Also, we want to think about how these ions are distributed. So outside the cell, we have an abundance of sodium and chloride, right? Sodium being positively charged, chloride being negatively charged. So there's sort of a balance of these ions, positive and negative, outside the cell. Inside the cell, we have an abundance of potassium and organic anions, such as uh, amino acids, which are considered organic, other negatively charged ions that are inside the cell that contribute to that negative environment. So those are kind of being balanced out inside the cell by the presence of potassium, okay? So when we think about the ion distribution, there's sort of a balancing that's happening in the extracellular fluid and a balancing happening in the intracellular fluid. So these are two important points to note before we continue.